When it comes to neck pain, there can be a lot of different reasons why someone could experience pain, but there are a few things in particular that are common causes of it, and a few things that almost no one commonly thinks about. Now, first, we need to understand the basic mechanics of the neck to make sense of how other things can influence it and cause pain. The neck should have some degree of curvature to it. We call this lordosis. And this allows us to have an airway that remains open, and so we can breathe effectively, which is quite important for survival, right? If we don't have an open airway, we're going to find a way to do it, because there's a lot of research that suggests if you can't breathe, you die. Now, in order for us to breathe effectively, our diaphragm has to be able to work to expand our rib cage out when we breathe in, and then as we exhale, we have muscles of exhalation help close this rib cage down. If we can't get optimal functioning of our diaphragm for a variety of different reasons that I discuss on my channel, then we're probably going to kick on accessory or secondary muscles of inhalation, and several of those are within our neck. Specifically, the scalene muscles and the SCM muscles have leverage to, when the diaphragm doesn't do its job very well, pull up the rib cage and elevate it, because they have leverage on the front side of our body to do so. Now, typically these muscles shouldn't be working that much during inhalation, but they are now for some reason, and that's probably because we lack proper respiratory function. So when you practice this, make sure that when you breathe in, you're not feeling any of that happen. When you breathe in, it should be silent, and it should be very, very soft. And that will allow you to relax that neck and use those muscles of inhalation, like your diaphragm, more effectively. And make sure you also follow those proper exhalation instructions. To best improve our breathing strategy without using our neck, getting in a 90-90 supported position like this, meaning we have a 90-degree bend passively at our knees and our hips, is generally going to be very ideal here, because this is going to put us in a position where we can maximally relax, yet still align the curvature of our spine from our low back to our neck. Now, we have a little towel roll underneath Trevor's neck, the midpoint of his neck. Now, this towel roll needs to be thick enough to the point where you feel like you're passively supported in your individual curvature of your neck, meaning that it's not actively pushing Trevor's head back or it's not collapsing him down. He should feel like it's just perfectly supporting him, allowing for his chin to be pointing straight up at the ceiling. So however thick that is for you, that's where you want it. Now, all Trevor is going to do is just stay totally relaxed through his body, and his hands are going to be on his lowest ribs right here. He's going to just very gently, and this is the key, gently exhale through his mouth, sighing the air out. And he's going to do that for about 5 to 8, maybe even 10 seconds. And at the end of that full exhale, he's going to feel his rib cage come down a little bit, and he's going to feel his side abs, not his six-pack abs, but his side abs, his obliques engaged just a little bit. And then he's going to pause, close his mouth, and put his tongue on the roof of his mouth. And he's going to inhale softly and silently through his nose. And he should feel his chest subtly rise, with his belly subtly rising, and maybe a little expansion in his back. And he's going to do the same exact thing. I cannot stress enough the importance of staying relaxed and making sure that you are going really soft. Softer and longer is always, always better than harder and more forceful. So if Trevor does it right, he will feel, again, a tiny bit of that side ab engagement, and he will maintain just 1 or 2 out of 10 of that side ab engagement upon inhalation through his nose. As for the tongue position, as I mentioned, I do want that covering the roof of the mouth. And if you're wondering what that should feel like, put the tip of your tongue behind the point where your front 2 teeth meet your gums in the back, and then cover the rest of the roof of your mouth with the rest of your tongue. And that's how you can make sure your tongue is in the right position. And obviously the biggest thing to look out for is Trevor feeling his neck engage as he inhales. He'll feel it, and you'll feel it. And if you're feeling that at all, that means you need to inhale softer. If you can't exhale or inhale without feeling your neck, then you might need to start with just nasal inhalations and nasal exhalations. And that might be a good place to start, and you can progress to exhaling through your mouth. But again, most people have the intention to breathe too strongly. So if you are, chances are you just need to go a little bit softer and longer. I recommend starting with this for about 2 to 3 sets of 10 slow controlled breath cycles, eventually progressing to the point where you can do this for minutes at a time, up to 5 minutes. And that will give you a really good start. Just make sure that you're only doing it for as long as you can without feeling any neck engage whatsoever. If you're feeling a panic response, like when you exhale fully, you immediately want to inhale, then you probably need to start with just the nasal exhalations and nasal inhalations for now. But as you get better at this, as you start to really master this breathing technique, start to work on increasing the duration of a pause between the exhale and the inhale. So Trevor would fully exhale, softly, 5 to 10 seconds, feel a little side abs. Now he's gonna pause. He's gonna put his tongue on the roof of the mouth, and he's only gonna pause for as long as he's comfortable. And he can pause for about 3 to 5 to maybe even 6 seconds, but never to the point where he feels like he might get a little bit of that panic response. It should always be very comfortable. Now, as a progression from this, you don't really have to change the position you're in, but we're gonna start to introduce a little bit of neck motion. Now, again, it's of the utmost importance. We are doing this very relaxed, and we're doing this to the point where we don't feel any tension in our body whatsoever. So the range of motion will be different from person to person, but all this entails is taking one arm, and I recommend doing both sides ultimately, but we'll start with one, reach it for the ceiling very gently. I don't want you to reach it so hard that your shoulder comes off of the ground. Just super chill is all you really need to do. And you're gonna start with your palm facing away from you. And then as Trevor inhales through his nose, he's going to very slowly and subtly rotate his palm towards his body as he turns his head towards that side. And he's only going to turn his head to the point where he starts to feel restriction. Once he feels that restriction, he's going to stop, not push through it, and he's going to exhale through his mouth, sighing the air out and returning back to that starting position. Should be very slow. So inhale through the nose, very subtly turn, exhale, very slowly return back to that starting position. And that's all you really need to do there. And again, only turn your hand as much as you feel comfortable too. So if you can only get to here, that's totally fine, but Trevor feels comfortable going to there, and that's totally fine as well. Just make sure that you don't feel any tension. That's the common theme. You'll know you're reaching too hard if you feel your shoulders shrug up into your ear. So just make sure that it's nice and chill. I'd recommend starting with this for about 2 to 3 sets of 10 slow reps. Now we're talking about just the cervical spine here, but if you have other spine curves that are throwing off what your neck is doing, such as your thoracic spine being in a very kyphotic or rounded position, or your lumbar spine being in more of an extended position, obviously those things are going to influence what's happening at your neck. So until you address what's going on here, you probably won't see a ton of long-term success. That's why I recommend my beginner body restoration program, which will address the position of the head, the trunk, and the hips and the feet. There's also other YouTube content I have on the ribcage and pelvis that you can easily find within my channel. Now let's talk about other potential factors, and this is where I think it gets really interesting. The first and most common thing, other than breathing, is going to be the position of the tongue. This is of the utmost importance. Many times people who have more of a narrow facial structure, they potentially got teeth pulled when they were younger. Also people that have more of a retruded jaw, and also those who potentially didn't breastfeed when they were younger to learn how to properly use their tongue and suck. Those people oftentimes have a tongue that doesn't rest optimally against the roof of the mouth. The way that I can most easily identify this is I'll just look at the roof of someone's mouth using a tool. Now you could use a camera with a flash, but what you're going to see most often with people who have poor tongue posture is that they will have a lot of ridges behind their front teeth, and we call this rugae. Rugae develops when you don't have the tongue resting against the roof of the mouth. So this is a clear indication that this person has a poor tongue posture. The tongue has an absolutely massive role in how we breathe, how we manage our airway and the position it's currently in, and also how our cranial bones move within our skull. This is of the utmost importance that we can do this. But the way that you would test this, keeping in mind that there are much more specific ways of doing this, is that you can open your mouth as wide as you can, and then take the tip of your tongue and place it on the roof of your mouth, just behind these 2 front teeth right there. Create that contact point, and then try to maximally cover the roof of your mouth with the rest of your tongue. Now try to open your mouth as wide as you can without losing any of that coverage. If you have a significantly less ability to open your mouth than you do when the tongue isn't on the roof of the mouth, then that can be an indication of a tongue tie, and that is something that you would need to see a myofunctional therapist about. This is why I am such a big fan of myofunctional therapy, because it trains people how to get their tongue on the roof of the mouth most effectively, and that oftentimes requires a more specific approach. The last most common reason I see people have neck pain is that they have poor alignment of their bite and their jaw. Now this starts to get into more of the dental world, and this is where I definitely am referring people out to people who actually are qualified to work on this type of case. Your molars, which are your furthest back teeth right here, have an absolutely massive role in how we sense stability within our head and our cranium, and to a lesser extent, the rest of our body and awareness of that side of our body. When we gently bite down, we should be able to feel molar contact on both the left and the right side. If you don't, that is an indication your jaw is deviated to one side. And that represents a TMJ that is oftentimes not in a good position. And that can lead to a lot of neck issues as well. Now, the way that I know that this is likely the case is I've worked with this person for long enough to determine that we're not really getting a change that's meaningful. I use objective table tests to determine whether I'm making progress with someone, and that is usually a really high correlation between people feeling better or people not improving. So if I have someone and I'm working with them for a while, we've gone through all the basic stuff, we've looked at their rib cage, their pelvis, their foot, their neck specifically, and we're still not really seeing anything good happen, or they can't hold on to adaptations that we get, then what I'll oftentimes do as a last case resort is I will look at how they bite down. I'll first see where they feel more molar contact, and then what I'll do is I will put a little popsicle stick in the back of someone's molars, and I'll have them gently bite down and then retest their range of motion. If they get a significant change, better than they did with basically anything else that we did, on one side or both sides, then that means that this person probably needs to see someone that can address this case. I will link a map of providers down below. Just make sure with those in your area, if you really want maximal benefit, work with someone who's taken cervical and cranial courses. But I do want to share with you all one exercise that usually gives pretty good results to someone who would benefit from this type of intervention. Now, there's a couple of different ways we can do this, but regardless, we're going to be pushing into our chin in some way, and we're going to be pushing our chin back against the resistance of our fingers for about a 2 out of 10 intensity. So it's an isometric contraction. And we're going to hold these things for about 5 to 10 seconds. Now, the first one we're going to do is place 2 fingers on the side of the chin. We'll do the right side, for example, right here. It shouldn't be too far back on the jaw right here, just on the side of the right chin there. And all we're going to do is just 2 out of 10, push our jaw to the left. But we're going to fight that, and we're going to resist that, and we're going to keep our chin going to the right, but ultimately what's going to happen is it's not really going to move. The chin's going to stay in the same place because it is that isometric contraction. And we're going to hold that for about 5 to 10 seconds. The other thing that we can do is we can press our chin back with 2 fingers like this. So we're going to try to protrude our jaw, but we're going to push against that, 2 out of 10 to start. And we're going to try to push our jaw forward, isometric contraction. We're going to start most people with about 1 to 2 minutes of total time, taking about a 5 to 10 second break in between each 5 to 10 second rep. And as I mentioned, 2 out of 10 to start, but you want to add 1 out of 10 intensity every couple of days. So for example, start at 2 for the next couple of days, then go to a 3 for the next couple of days, then go to a 4, to a 5, but you don't want to ever really go past a 5. You want to stay at. Now, if you think this bite thing is you, I bet you it's likely not, because most people fall into the first 2 categories. And if you do end up being this type of person, then you need to work with someone in person individually. You can't fix these issues off on your own.